I'm Dr. Professor PC Manoria, Executive President, 4th World Congress, Cardio Kidney Metabolic Medicine, 18-19 April, Hotel Leela, Mumbai. I'm at the Right Doctors studio, and with me is Madam Niti Desai, renowned dietitian of the country. So the first question I'm going to ask is, what is the role of nutrition in sportsmen who are actively involved in sports, like a very fast bowler or football? What is the role of nutrition?
Nutrition actually plays a very important role. There's a whole field of sports nutrition there. So, because these bodies are subjected to intense stress in terms of physical activity, there has to be appropriate nutrition for recovery, repair, so that they can perform the best the next day and day after that. So, there are lots of components to sports nutrition, but yes, nutrition gives you that extra edge to excel when you are at that competitive level.
Which nut is better for cardiovascular health? Cashews, walnuts, almonds, and so on.
Generally, we suggest that you have a mix of walnuts and almonds because walnuts are rich in omega-3. And of course, all the nuts have the good fat, the monounsaturated fat, MUFA. And there is a lot of fiber. There is some amount of protein. It gives you a lot of satiety. But pistachio is one of my favorite options because you can eat 23 to 25 pieces of pistachio and it still gives you only 100 calories, but it gives you a lot of satiety. So pistachio can be a low calorie, good snack. The time when you think you don't know what to eat, you're very hungry, go for the pistachios.
A patient who has undergone angioplasty for a heart attack has high cholesterol. Can he have eggs?
So the guidelines say that if you had if you have a history of heart disease, then you should be having 3 to 4 whole eggs in a week. Egg yolks are the issue. Egg whites can be unlimited. You can have any number of egg whites. If you don't have a history of heart disease, there is no dyslipidemia, then you could have 1 egg every day. Because egg is a complete protein and it's packed with a lot of vitamins and minerals as well.
Should a diabetic patient completely avoid carbohydrates to control his sugar?
Not at all, not at all. The issue is the quantity and quality. The quantity needs to be portion control, and the quality, we need complex carbohydrates, less refined carbohydrates. The ones which are not polished is what we want to have. In the Indian scenario, of course, our problem is that we eat a lot of carbohydrates. So even if we are able to reduce our quantity of carbohydrates and improve the quality, have less refined from, say, white rice, if we can move to brown rice, from poha, from upma, suji, we can move to jawar or bajra suji. Still, we've done a great job.
Is brown sugar or honey better than white sugar for diabetic patients?
Unfortunately not. They behave all in the same way. They spike the blood glucose as much, whether you call it white sugar, you call it brown sugar, you call it cane sugar, you call it palm sugar, you call it jaggery. They behave in the same way. Jaggery might be slightly more healthier than white sugar because it's less refined. But when we are talking about diabetes, then the calories and the blood glucose spike is the same.
And can small frequent meals useful to diabetic patients?
So it's a controversial topic. Some people say that you should have every few hours, but what you have matters. In the Indian context, if it's going to be only biscuits and vada pav and samosa as your snack, then small and frequent meals do not matter, are a problem. But if you can have a handful of nuts or chana as an in-between snack, you can afford to have small and frequent meals. Very often what we see is that if you can only have breakfast, lunch, dinner, that also works. But we see that generally those meals become large because there are long gaps and then the caloric intake goes up. So there are pros and cons, and it works differently for different people. It's not one size fits all.
So thank you very much for your quick takeaways. Thank you, Madam.
Thank you so much. Always a pleasure.